If you run a medical practice, a dental office, or any kind of healthcare business, I want to start with one number: 98,000. That is how many HIPAA cases the Office for Civil Rights, the OCR, has investigated and resolved. Not 98, 98,000. And most of those cases did not involve a cyber attack on a major hospital system. They involved a personal phone, a Gmail notification, a vendor who never signed a piece of paper. I am Anmol, co-founder and CEO of Emitrr. We work with more than 1,000 healthcare practices. And when I say I see these violations time and again, I mean it. In this video, I am going to walk you through the 11 most common HIPAA violations, tell you which ones show up most in small to mid-sized practices, and tell you what actually needs to change. Let's start with the communication violations. These are the ones that come up most frequently, and they are almost always unintentional. Violation number 1. Texting patients from a personal phone. This is probably the single most common HIPAA violation happening in healthcare right now. In a survey, it was found that 73% of healthcare staff use personal phones for patient communication. 73%. Think about what that means. More than 7 out of 10 staff members are texting patients from a device with zero encryption, no access control, no audit trail, and no business associate agreement. It doesn't matter if the message is just an appointment reminder, if it includes the patient's name and any health-related context, that is protected health information. And if it's going out from a personal iPhone over standard text messaging, you are in violation. I know that can feel overly strict, but fines go up to $50,000 per violation, and they compound since every message is counted separately. Violation number 2. Sending PHI through Gmail, Outlook, or standard email notifications. Many practice owners assume that a business Gmail account is different from a personal one. For HIPAA purposes, it is not. Standard Gmail and Outlook are not HIPAA compliant unless you have a business associate agreement in place with Google or Microsoft, and encryption is properly configured. Here is where it gets really specific, and this one surprises people. A lot of communication platforms send email notifications to your staff when a patient message comes in. Phone systems, voicemail tools, texting platforms. If any of those notifications include the patient's name, their phone number, or any health-related detail inside the email body, and it lands in a regular Gmail inbox, that is a HIPAA violation, every single time. I have told this to practice managers who have been running their office for 10 years and had no idea. Violation number 3. No signed BAA with your vendors. A business associate agreement. BAA is the legal document that makes your vendor accountable for protecting patient data under HIPAA. You need one with any vendor who handles patient information. Your phone system, your texting platform, your intake forms provider, your scheduling software. If a vendor says they are HIPAA compliant but they will not sign a BAA, walk away. That is a red flag. It means the compliance claim is not backed by accountability. And it's not just about having one. If the agreement has not been updated since before the HIPAA omnibus rule changes, it may not hold up. Violation number 4. Unencrypted calls and messages. Encryption is what protects patient data if something goes wrong. Think about it this way. If your system is breached and everything is encrypted, the data is unreadable. If it is not encrypted, the breach becomes the violation. The University of Rochester Medical Center paid a $3 million settlement after an unencrypted flash drive and an unencrypted laptop were lost. They had been told encryption was a high risk years earlier after a similar incident. They still had not fixed it. Every phone call, every text, every stored message, all of it needs to be encrypted. Violation number 5. Unauthorized access. Snooping on patient records. This happens more often than most practice owners realize. An employee looks up a neighbor's records out of curiosity. A staff member checks on a family member's chart. Someone pulls up a coworker's medical history. In 2017, a staff member at Lowell General Hospital in Massachusetts was fired for accessing the records of 769 patients without any clinical reason. UCLA Health was fined $865,000 after a physician had been accessing celebrity patient charts without authorization. The violation here is not just the staff who did it, it is the practice that did not have controls in place to prevent it or detect it. Violation number 6. No access controls. Everyone sees everything. Your front desk receptionist should not have access to call recordings meant for the provider. Your billing team probably does not need to see clinical notes. Access controls mean you define who can see what, and the system enforces it. If your phone system, your texting platform, or your EMR does not allow you to set different access levels for different roles, you are exposed. Violation number 7. No audit logs. An audit log is a record of who accessed what and when, If a compliance investigator asks you to prove that your staff only accessed records they were authorized to see, what do you show them? If the answer is nothing, that is a serious problem. You cannot demonstrate compliance without evidence. Now let's talk about physical and operational violations. Violation number 8. Improper disposal of PHI. A printed patient form thrown in the regular trash, an old laptop donated without being wiped, a USB drive sitting in a desk drawer. These are violations. Patient information has to be destroyed properly, shredded, wiped, or disposed of through a certified way. This applies to physical paper and to electronic devices. Violation number 9. Discussing PHI in areas where others can hear. The front desk calls out a patient's name and date of birth loud enough for the waiting room to hear. A provider discusses a patient's condition in the hallway. A staff member takes a call about a prescription while walking through a public area. None of this requires bad intent. It just requires a public space and a patient's information. That is enough for a violation. Now let's talk about the two that are increasingly showing up in enforcement and that a lot of practices are not thinking about. Violation number 10. Social media posts that include patient information. In the year 2025, a nurse was investigated after live streaming a video of herself at work during a medication pass. That is an extreme example. But social media violations happen at a much smaller scale all the time. A photo that has a patient chart visible in the background, a post describing a patient case with enough detail that someone could identify the person. The rule is simple. Do not post anything from a clinical setting without checking there is no PHI visible anywhere in the frame. And that policy needs to be written down and communicated to every person on your team. Violation number 11. Failing to give patients timely access to their own records. HIPAA gives patients the right to access their own medical records. And the Office for Civil Rights has been actively enforcing this. As of the end of 2025, they have issued fines or settlements in more than 54 cases specifically for this one violation. Patients are supposed to receive their records within 30 days of a request. If your process is slow, unclear, or non-existent, this is an active enforcement risk right now. Okay, now let me be straightforward about something. Violations 1 through 4. The communication violations are where the majority of exposure lives for healthcare practices. Because those are the everyday behaviors. The personal phone, the Gmail notification, the vendor without a BAA, the unencrypted text message. The fix is not complicated. You need a communication platform that signs a BAA. That encrypts every phone call and every message. That masks PHI inside any notification going out to your staff. That gives you access control so you define who sees what. That keeps audit logs, and ideally one that syncs every patient conversation directly into their chart inside your EHR. That is exactly what we built at Emitrr. Every capability I just listed, purpose-built for healthcare practices that need to be compliant without needing a compliance department to manage it. We sign the BAA, every phone call and every text is encrypted. Notifications to your staff are masked so no PHI leaks through to a regular inbox. Access controls and audit logs are built in. Every patient conversation syncs automatically to the patient chart inside your EMR. If you want to see how it actually works, go to Emitrr.com and sign up for a demo. The link is in the description below. And if you found this useful, subscribe to this channel. I put out videos like this regularly, practical information for healthcare practice owners on technology, compliance, and patient communication. Thanks for watching.